Good evening. It's Tuesday, January the 5th, 2021. Segel, David Lahash, Juts, and welcome to today's COVID-19 Task Force update on this, our 165th show. Today, our guests will include Peacekeeper Communications Officer Kyle Zachary. We'll hear from Lisa Westaway, the Executive Director of the Kmhc, and Don Montour-Lazare and Juanita Belanger of the Kmhc. We do have a very busy and informative show for you tonight, so we won't waste any of your time. And here's Kyle. Kyle?
Thank you, Dave. I will be brief today. Oh no. Live TV. I will be brief. I'm here to give you an update on the pandemic from a Peacekeeper's perspective. So yesterday it was reported widely that Chief Peacekeeper Zachary tested positive for COVID-19. It's important to note that no other members of the Peacekeepers, be it officers or civilian staff, after contact tracing, none of our members had to isolate or do anything further to that. I spoke with Chief Zachary this morning. He told me he's doing well, all things considered, and on behalf of the Peacekeepers, we wish him a speedy recovery. On to business. On January 1st, at 10:26, the Peacekeepers received a call about a cigarette store on the Highway 138 that was still operating despite the guidelines set out in Directive 55. Peacekeepers responded to the scene and found that the store was, in fact, still operating. 2 tickets were issued during the interaction. The first is to the business that was operating, and that was the $10,000 ticket. The second to the cashier who was working that day, the $1,000 ticket with fines, with fees and court costs. Altogether, the 2 tickets came up to $16,543. Now, when we announced this on our Facebook page, we were met with comments that this may have been excessive, but the reason why these directives are in place is for the greater good, for the greater health of our community as a whole. And so we're going to continue to enforce these directives as part of our mandate because we care about our community, and we're going to continue to do that. We have to all be working together to get this pandemic to be behind us, a thing in the past. So Peacekeepers, nobody wants to be issuing these kind of fines. These are big fines. It can be looked at as excessive, but when you think of it in the long term, it's a deterrent to future business owners to follow the guidelines and to stay within the guidelines that have been set out by the task force. There are people who don't wish us to be enforcing these kind of mandates, but we have to. It's our mandate to protect all life within the community of Kahnawake, and we're going to continue doing that. If we don't, I have to commend the task force, all the members that are present here today especially. They've done a fantastic job up until now. This isn't an easy thing. This is hard on everybody, but if we didn't do it, our community would be ravaged by this virus, and that's something that nobody wants. People will say, well, it's only fatal to 1% of people. The population of Kahnawake is hovering around 10,000. 1% of that is still 100 people, so even 1 is too much. So this is something that we have to think of moving forward. We all have to pull on the chain in the same direction all at once. And finally, mental health. January is going to be a long month for a lot of people. A lot of things are going to be shut down. If you feel like you need to talk to someone, if mental health is an issue for you, make it a priority, because physical health and mental health, They go hand in hand. They're one and the same. And if you need to talk to someone, you can call the Peacekeepers directly, 450-632-6505, and we can put you in touch with a professional that could help you, that could be an ear for you to listen to, for you to vent to, a shoulder to cry on even if you need it. So make sure you're taking care of your mental health, and we're close. We're getting close to the end. With the vaccines rolling out, I feel like we're coming close to the end. And we'll all get there together if we all listen and pay attention and be safe and protect one another. So that is it for me. Thank you for your time. Now go on.
Nyawa Kyle. Now we'll hear from Lisa Westaway, the Executive Director of the Kmhc. Lisa, thank you.
Good afternoon. I have quite a few subjects to discuss today. Firstly, I would like to talk about what we're expecting from Quebec and the relationship with us here in the community. So, as you know, it's widely advertised in the newspapers that we're expecting a more significant lockdown from Quebec. So many questions that we're already receiving today is, are we going to follow suit? What's going to happen here in Kahnawake? So although Don and Juanita will speak to you a little bit more about our numbers here in Kahnawake, we have done and continue to do every single day, more than once a day, analyses of our cases. And we do not feel that it's that we need to move towards the type of lockdown that Quebec is going to be putting in place. And why is that? The reason for that is because we have already been in that type of a lockdown. So I just want to go over some of the measures that we have in place that are already more significant and have protected us in a significant way since September, I would say. So let's start with the schools first of all. So we took the three bigger schools, so Gardunya Noru, KSS, and Kateri. So of the three schools, there are 762 students. Since September, the first week since September, 561 of those students have been home doing online learning. So that's 74% of the three schools that are doing online learning. That is quite significant. Quebec never put that in place. Their students were in class in huge bubbles without masks while they were in class. And so that is a very different scenario for us in Kahnawake. Our schools have not had any outbreaks, and they are well controlled environments. It's not to say that we can't have COVID in the classrooms. We can. We know that COVID-19 is silent. We know that anybody could have COVID-19 at any particular time and can transmit it unknowingly. However, we have not had any cases attributed to the schools. Teachers were trained on infection prevention and control measures. Schools and classrooms were adapted. Also, the air quality was analyzed, all with very positive results. And therefore, our situation is very different. However, despite that, so of this 25% or 26% of the students that are in the classroom, those are our essential service, children of our essential service workers, people in the community who have to be at work, who are working every day to combat this virus. Also in the schools, part of that 26% are vulnerable children of vulnerable families. Vulnerable could have a variety of definitions, and that is the Ed Center that looked at defining that. However, vulnerable still means vulnerable, and it means that when we look at changing that scenario, we have to also have a balance between well-being of our community as well. So despite all of this, despite the fact that 74% have been online since September, at the present time, as you know, for this week, vulnerable families who are able to keep their kids home are doing so, and that has increased up to 87% of children in our schools that are actually online learning. So we'll continue to evaluate that as we go every single week based on the situation that is happening in Kahnawà, but we thought it was important to actually give you those numbers. We'll look also at step by step. So actually this week, of the 110 that are registered, there were only 32 children present yesterday. There were rumors going around that step by step closed, but in fact it was because many of the educators were sent home because there weren't enough students. There weren't enough kids in the daycare. So again, our daycares are opened for vulnerable families, for families of essential service workers. And another difference in our daycares compared to in Quebec is that our educators are in full PPE. Our children are in bubbles of 2 to 7 students. The bubbles do not change, and the educators do not move from classroom to classroom. In being organized in this way, in being extremely structured, in having sanitary measures, infection prevention and control training regularly, we are able to maintain our daycare in this way, in a safe way, both for educators and for the children. Again, there is always risk. We're not saying that we eliminate risk 100%. That is not possible. But it's about finding a balance, of being able to move forward. And the other big difference in our schools, in our daycares, in all of our businesses, and in our community organizations, we all do health checks. All of our employees every day, our students, our daycare employees, our daycare children who come in, we do health checks every single day, actually on paper, evaluating our symptoms, and we stay home when we're sick. That is a big difference from in Quebec. We are actually monitoring those things. We follow them on a day-to-day basis. We check those results every single day. We send people home when they're sick. This is not happening, this type of structure and control that's happening in our businesses, in our organizations, in all of our environments that allow us to be safe. And so that means when Kyle congratulated the task force before, what is really important is that we congratulate each other, because we are all a part of this combination, of this success that we're seeing moving forward. Despite the fact that we have many cases right now, despite the fact that we have some clusters, we still have success, and we have to remember that, and we have to hold on to that and continue for the next little while. So our businesses, as I said earlier, we had taken some preventative measures knowing that the holidays were going to generate increased cases. What were our preventative measures? We closed retail, and we will make a few changes also. We will talk about a few more closures, most probably on Thursday, very limited closures, but just preventative. And again, these are preventative measures, knowing that we need to stay home. That's the most important thing right now, is that we stop moving and we stay home as much as possible. This is why, if you can keep your kids home, then please do so. If it's not a burden to you, if you're able to do it, of course, again, remember, we always will promote individual decision-making based on mental health, based on what's best for your family, based on education and knowledge of your situation. Again, our businesses have been closed since the 1st, and this is preventative, knowing that we expected increase in cases, and we wanted to ensure that people were home so that we can contain whatever increase we had within the community. So we are on track. We are doing what we need to do. We need to continue to do this for some time coming. And there have been some situations that have been difficult, and Don and Juanita will be speaking to you about that in a little bit. Okay, so other news that I want to bring to you is about vaccinations. Two things, well, actually many things. So there is a release that just came out recently. As you know, the Quebec priority list has, right now we are following the Quebec priority list. So the first 4 areas of priority, which are a priority for the ministry and the Quebec government, the first 4 of their, I think, 12 priorities. The first are elders in long-term care facilities, in intermediate resources. Those are our most vulnerable community members, and those are prioritized as number 1. Those, that population will receive the Mrna vaccine. So I'm very happy to announce that our elders at Kmhc Inpatient and at the Elders Lodge will be vaccinated tomorrow. This is really exciting news. All the elders have been spoken with, their families as well, and we'll publicize that, and we'll show you some videos and pictures after the day tomorrow, and we're all really excited to get that going. So that's the first positive news that I wanted to share. Employees. So number 2 on the Quebec priority list are employees of health and social service establishments. So that means that Elders Lodge, Kmhc, KSCS, ILC, health and social service workers are number 2. Those employees are being asked to have their vaccine given by the Pfizer vaccine at a site that's off outside of the community. And we've spoken about this already before. For the time being, it's employees of Kmhc Inpatient, Elders Lodge, and ILC that are prioritized. Recently, we have employees of operating rooms, COVID wards, hot units, dialysis units, operating rooms, emergency rooms that are prioritized. However, very shortly, probably by February, we'll see a mass vaccination of all health and social service workers and first responders. And so again, that will be happening very shortly. Third on the list are private residences. That doesn't impact us because we don't have really any what we consider private residences. Fourth on the priority list are remote communities. So as I've mentioned before, there's been a lot of, I've been participating in many meetings. There's been a lot of effort put into ensuring that First Nation communities, whether we be remote or not, that all First Nation communities within Quebec be prioritized. So I'm happy to announce that an agreement between Indigenous Services Canada, the Ministry of Health, was made last week, and that we have come to an agreement that all First Nations communities will be prioritized in Quebec at level 4 priority, so at the same level of priority as the remote communities. And so we will be providing you with further information about the rollout of the vaccination campaign very shortly. In the meantime, we are preparing. So somebody said, why do we need a committee to prepare? So I'm just going to explain to you a little bit about preparation. So actually, we are preparing to vaccinate 6,553 people. We really hope, and we'll be working on this to vaccinate at least 80% of that population. That's our goal, and we're going to work towards that. And so vaccinating, what we're really happy to announce is that the 207 Longhouse is participating with us. Firstly, we are going to be vaccinating at the bingo hall. Ivan Thompson is participating in our subcommittee, so being very involved in all the logistics. We have to ensure that we respect COVID measures when we vaccinate. So there's a lot of preparation that's involved there. There's registry, there's documentation, there's flow. We need, we'll also be needing 20 to 30 30 people to be able to work the vaccination site, and we expect the vaccination process to roll out over at least a 2 to 3 week period once we start rolling. So this takes significant organization, and that's why we have a subcommittee that's working very quickly to get this vaccination site ready so that we're prepared as soon as the vaccines are here. What I thought would be interesting today, although we do have a pretty long show, was to just cover a few questions and answers. So about vaccination, because we've been getting a lot of questions, so I thought it would be important to talk, to give a few answers. Dr. Gauthier actually worked on this document. It's a document that will change and be modified as we get new information. It will be on our COVID-19 Kmhc website. We're going to have a special section for vaccination information, and that should be ready very shortly, but I'll just read to you some of the questions and answers today. Is the vaccination going to be mandatory? So as you know, vaccines are not mandatory. We highly recommend that everybody be vaccinated. However, we cannot force you to be vaccinated. Do health instructions of distance, hygiene, and masking have to be followed once we're vaccinated? Yes, we have to continue to follow distance, hygiene, and masks because it's going to take some time before our whole community is protected against COVID-19, and therefore we have to maintain these health instructions for some time to come. Can I get COVID-19 from the vaccine? No, you absolutely cannot get COVID-19 from the vaccine. So I would suggest that you look at the video that Dr. Gauthier placed on this page some time ago, but just a little explanation, a very basic explanation, my non-medical explanation. What's injected in the vaccine is a very small part of the virus. The body is unable to create the virus from that small part that is a part of the vaccine. And therefore, the medical explanation is in Dr. Gauthier's video, but that's my small explanation. So there's 90% of the virus that's actually missing from the vaccine. It's only 10% of the virus, and therefore your body cannot create the virus from that vaccine, nor will you test positive if you end up being tested following a vaccine just because you've been vaccinated. So the COVID-19 vaccines were developed quickly. Does that mean that they are not safe? So yes, they were developed quickly, but not all the steps of development were done so quickly. So yes, they are safe. In fact, the mRNA vaccine technology has been studied for over 10 years. So what enabled the research and development to be done so quickly was all the countries across the world gathered together to share data and information. And by them coming together and sharing this, as well as funding, they were able to move a lot more quickly. Also, many of the steps involved in getting a vaccine to market are usually very sequential in nature. So in order to make this process speed up, all of those sequential steps were done all at the same time. So those are some of the reasons why we're able to move very quickly. It was really a worldwide effort. I don't want to keep you with too many more questions. I'll go through a few more. How long will immunity last? This is an important question. Right now, we only have data up to 3 months at the moment. So we continue to analyze this data, and we will provide more information as we have it. Can the COVID-19 mRNA vaccines change our DNA? The answer is no. Messenger RNA, and this is right from Dr. Gautier's mouth, because this is not from me. Messenger RNA is delivered to cells through lipid nanoparticles. The mRNA and the spike protein that is made gets degraded within 1 to 2 weeks. Human cells do not make reversed. Human cells are not able to create this within their genealogy. So no, they cannot. We cannot. Our DNA will not be changed from the vaccine. I think that's all I'm going to cover today. As you can see, there are many pages, many questions and answers. I tried to cover the ones that we're hearing about the most right now, but again, you will have access to this full document on the website. Okay, a couple of other smaller things that I wanted to mention. And again, this will be addressed a bit more by Dawn and Juanita, but important to note, a press release will come out later today about advising you about where to go to look, about flights coming into Montreal that have confirmed cases of COVID-19 on those flights. We know for a fact that we have community members who traveled in the last week or so and who were on those flights coming home, and we urge anybody who traveled to quarantine for 14 days upon return. It is extremely important. If you develop symptoms, you call the testing site immediately and you come and be tested. If you have no symptoms, we ask that you wait 1 week from the time you return and then that you get tested if you were on one of those flights with COVID-19. This is extremely important. And we urge you to look at the release and go to the website and determine for yourselves if you were on a plane that has been identified with COVID-19. If you have been on a plane that has not been identified with COVID-19, you still have to quarantine because you could have been on a plane with someone who has COVID-19. And those are the rules to quarantine for 14 days once you cross the border. I think that's it for me for today. I'm going to pass you to Dawn and Juanita. They're going to provide you with information about actual results at this time, about contact tracing. And there's one thing that's really important for me to tell you today, and it's that we are coming to you not from a place of fear. We are here to give you information to allow you to make important decisions, for us to work together as a community. We are not trying to generate fear, we're trying to give you knowledge. And the next few weeks is when you need to use all the knowledge that you have at your disposal to make decisions that allow our community to remain safe. Dawn and Juanita will give you a bit more information about that so that you can have, again, more knowledge, more understanding of what's happening in the community right now to be able to make those decisions. And I thank you very much for listening.
Thank you very much, Lisa. And indeed, some really good news here for the community in regards to our elders and those most vulnerable who are going to be vaccinated over tomorrow and the next week over at the ILC. And as Lisa mentioned earlier, we have two health representatives here from Kmhc, and we'll start off with Dawn Montour-Lazare. Dawn?
Okay. All right, so I'm coming representing the Kahnawake Public Health Team. So basically, I'd like to tell you about how we do contact tracing in Kahnawake compared to what they do in Quebec. So our objective with contact tracing is to make sure that people who test positive know that when they tested positive, that they make sure that they isolate for the time that they need to isolate. And we ask them a lot of questions to find out what their history is, what symptoms they've had, when they started having symptoms, if they've had symptoms, because sometimes we do have people that have had no symptoms along the line and tested positive. Some people have gotten tested because of being in contact with somebody who's tested positive, so but have no symptoms and decide, after a few days that they just want to find out if they're okay, so they find out they're positive then and have never had symptoms along the way. We also have a lot of people that, have very mild symptoms. So like we're looking at, maybe a little bit of a headache and achiness, and or think that they just have a slight cold or a stuffy head. I had one person say that they had a head cold. Other people say they really had nothing. They just thought it was, like it. And that's the other thing is sometimes the symptoms. People think that the symptoms are supposed to last for a long period of time. We've had people that had symptoms for less than 24 hours and then test positive. So there's no correlation with severity or length of time on whether or not you test positive. If you have the virus, it's going to show, and we can't tell you whether or not you will have it based on what your symptoms are. Our whole objective, again, is to make sure that people in Kahnawake stay safe. We want to make sure that we don't have any more spread in the community. So we don't have any personal stake in this. We're not coming in here to lay blame to anybody. We're really just trying to find out who we need to call next to make sure that they isolate so that they don't spread the virus in case they are infected and they don't know about it yet. It's important that we do that. The other thing is that it's important to keep track of who you're in contact with. It's very difficult when we call in and now you're in an emotional state to say, like I just told you you're positive, and now you have to try and think of everybody that you've been in contact with. We've been doing this for quite a few months now. People don't intend on forgetting to name anybody off on their list, or and we've had people call us back and say, "Oh my God, I forgot about so and so." And this is our experience even from the very beginning in going all the way to March, when it was people within our organization that had COVID, and we were so nervous about getting about who we might have been in contact and might have spread it to. So. No one's immune to that. We're human. We forget all these little details, and it's very difficult. So let's say if we test you today, but let's say you had symptoms 4 or 5 days ago. We always go back 48 hours before you started having symptoms, or at least 48 hours before you had your test, let's say if you had no symptoms. So you have to think about every single person you've been in contact with in the last 7 days, if let's say this is the 5th day after you had your symptoms. So you're thinking of 7 days of people you've been in contact with. This is especially difficult before we had a lot of our lockdown situation that we have now, when we're still having gatherings at least with one household or with 2 households during the holidays. All those things that we were doing contributed to the number of people that we're having to contact right now. How do we find out about the cases? Well, majority of the cases we find out through our testing center. I check the results every day to see who's tested positive, who's tested negative, and then we start laying the process of calling the clients right away. But we work with public health at Montour-Lazare to do all the documentation that needs to be done, and so we have to wait for them to let us know when they have all the information. Now, like I say, when it's being tested in our community, we know that we have the information at our fingertips because we have all access to all the results. But when people get tested outside the community, it takes a little bit longer, and sometimes can take sometimes a couple of days. So we don't always find out about it till much later. We do have a way. We do have a way through our public health system to get the information, but they don't always post it up as quickly as we get it when we're doing it through our testing center. So we'll call the case, and we'll, like I said, we ask them how they've been, who their symptoms are, who they've been in contact with. Once we get that list of contacts, we will contact each person that we've been given, and we will let them know that they've been in contact with somebody who's tested positive. Unless we have the permission from the original case, and usually I will tell the person, like, if you want to contact your contacts first, so give them a heads up. And I'll wait a bit before I call them. But sometimes they don't feel comfortable doing that. So we'll call and say, like, you've been in contact with somebody who's tested positive, and just give them the direction that they need to do to keep themselves safe. So the difference with isolation between a case and a contact, so somebody who has been tested positive, we're isolating them for 10 days because of that's the period of contagiosity, the time when they can be actually passing off the virus to other people. So that starts from 2 days before they start having symptoms to 10 days afterwards. Lots of studies have been done now. We have a lot more data at this point. So they know that after 10 days, people are not contagious anymore. Now, the difference is when we tell somebody to isolate for 14 days because they've been in contact with somebody who's tested positive, is because it can take up to 14 days for the virus to start to show up in a person. It's called an incubation period. So we want people to stay safe and isolated from other people, so to make sure that they don't start developing symptoms, because if they continue going out everywhere, then they're possibly affecting a whole bunch of other people within their circles. And we have bubbles, but we have to remember that every person we have has a bubble and more bubbles and more bubbles, so it can increase exponentially very quickly. Now, the difference that we do, we're still contacting all their contacts, and we're doing our best to try and contact everybody, but we can only do based on the information that's given to us. So that's why we depend on our cases to give us the contacts, and we always invite them to call us if they remember anything else. But we also call them back to make sure that they're doing well. For one thing, we want to make sure that they're still managing well and to make sure they're not getting sicker. But we also want to make sure, like, have you thought of anybody else that you may have got in contact with? Because sometimes they forget. But the thing that's different between what we do and what Quebec does is Quebec right now is not doing the not contacting the contacts of cases. So basically, if let's say you test positive tomorrow, they're going to call you and they're going to say, okay, so you have to isolate for till this amount of time, and they're going to say, well, I need you to think about all the people you've been in contact with, and we need you to call them and let them know, and we're going to email you the instructions for your isolation and for your contacts isolation, and then you will have to send it to them. So we're taking that part of the equation out of there for the person who tests positive. We're doing all that. We're contacting the people. We're sending the information that they need to keep themselves safe and what to do for isolation. It's not being done in Quebec right now because of the amount of cases that are happening right now. There's no way that they'd be able to keep up with what they're doing, what we're doing right now. And it's becoming increasingly difficult for us to do it as well too. We're doing our best. And maybe not as timely as it used to be, but it's based on the fact that we're getting so many cases. We have 13 active cases right now. We have a few more cases that we know that a few more people that we know that were tested today that we are really tracking because we know that they were in contact with somebody. So we're always trying to be on guard. We really truly knew that after the holidays we would be having a surge, and we are seeing it. We were allowed to gather at the holidays, but we're paying for it right now. So we're really trying to encourage people to stay home and not to gather and not to intermingle right now, so that we can get the cases down. The bottom line is it's not about you, it's about everybody else around you, and we want to keep the community safe. So we really are urging you not to do that as much as possible, because it really impacts on us. And I was worried about doing this, but anyway. On New Year's Eve, I started off my day by opening up my computer to see the results of the tests that had been done the day before. And I opened my computer, and there was 5 lines of positive cases. And I started crying. And Arnold was asking me why I was crying, and I said, I'm worried about the community. That's what bottom line. It's about where Juanita and I have said this before. We're so afraid that we're going to miss something. We're so afraid that we're not going to catch everybody. And we do our best, but we have to go based on the information that we get. So we certainly do everything we can in our power to do that. And we're really worried about the community. That's what our best interest is we just want to make sure the community stays safe as much as we can. And we just want to I would like to reinforce that Kahnawake up until now has been very proactive. We've been ahead of the game, surpassing what Quebec's restrictions have been, because we want to make sure the community stays safe. And Quebec has been more reactive, so they go based on whatever happens, and then they start shutting down, where we've been shutting down to try and prevent all this kind of thing. I know it's not 100%, but I think no matter what we would have done one way or another, we would have got criticism for it, and I've been saying that from the get-go. If we get criticism because we don't have a lot of cases, we've done our job. But we were going to get criticism one way or another, whatever we did. So it's not on us. It's on everybody. It's on every single individual member of this community has to take responsibility for their own actions and make sure that they take care of the community as well too. So I'm asking you, I'm imploring on you to please follow the guidelines, because the 12-hour days that we're doing, this is like my 9th day of 12 hours, and it's starting to prey on us, and I just really want people to think about what they're doing. I want to end with wishing that I hope that all the families that we're dealing with right now that are living with COVID right now, I hope that they have a speedy recovery, and we're here for you. Call us anytime, we're here for you. Yeah, I won't go.
Thank you very much, Don. Moving words indeed. Now we'll hear from Juanita Belanger of the Kmhc. Juanita?
Hi. Thank you. So it's a little bit hard to follow that because that was such an emotional plea, and I've been working hand in hand with Dawn throughout this this second wave very closely, and so I know exactly what she's feeling because I'm feeling it. We're not a big team, you know, we're not a big hospital, big of heart, big of spirit, but few of people. So we're doing our best right now to try to manage something that is very quickly becoming unwieldy. And so I'm sure most of you listening right now, you know better than I do what's going on in this community. So we realize that there's a lot of stress and a lot of emotion and a lot of fear right now. Tons of anger, I think, too. But what I'm here to talk to you about is how can we, I want to plead to your sense of community, and I want to plead to your sense of responsibility to not only your family, but yourself. So what's important from the perspective of infection prevention and control is that, you know, we have to do what we can. We have to take those controls that we have and we need to apply them as stringently as possible right now. Everybody's aware that there's an outbreak at the Elders Lodge, so we are taking care of that right now. We have, as Dawn said, I believe it's 12 or 13 cases currently, and we have more that we're expecting. And by extension, we have lots of people who are contacts of those people. So there's quite a lot going on right now. And what we have to remember is that there are things that we can do. And what we need to be doing is we need to be distancing, we need to be wearing our masks, and we need to be making sure that we are doing all the sanitary measures that we can to keep ourselves and our families safe, and by extension, the greater community. So, you know, all those things that everybody is so tired of hearing about, and let me tell you, as tired as you are of hearing this, I am tired of saying it. I repeat myself 1,000 times a day, and you know, I'm as excited for the other side of this as anybody to be able to not have to say this every day. But the truth is, we are really in a position right now where we have to buckle down. We really have to. We have to remember what the principles are, what are those 3 basic pillars, and how can we continue to do what needs to be done to keep everybody safe. But we also have to think about the fact that there's not necessarily blame to be given here. I don't think that people are doing anything intentionally. I don't believe that anybody is trying to infect other people. I think that we have some degree of COVID fatigue right now. We all do. I do. Everybody does, you know? And so in terms of the public health team, we give the information that we can. We give the information that we have based on what we have received, as Dawn said. But we also try to promote these things as well, and we try to remind people of the things that I think most of us are already aware of right now. And so you know, we meet at the hospital regularly and we have these meetings once a week. And today in our meeting, you know, we were all kind of emotional and we were all having a reaction to the tiredness and I think just the emotion of being 10, 11, 12 months in, I don't even know how long anymore, of most of us working, 12 plus hour days and really trying to get a hold on something that we feel like maybe we're losing our grasp on a little bit. And I was talking about a conversation that I had with my husband this morning where, he said, if, the schools have been closed now, so who's everybody going to blame for the number of cases that are out there? And it was a moment where I said, you're right, because what I think people are forgetting is that what spreads COVID is people. So at one point we were seeing cases in schools and everybody was saying close the schools, and then we were seeing cases in workplaces, and so they shut down the workplaces, and then people are saying there's no cases in gyms and there's no cases here, so why are those closed? But now we're seeing cases because of gathering. So ultimately what's going to move this virus is people. We move it. It can't go anywhere. It's not able to do anything unless we move it. So we have to take that responsibility for what we do. So whether you're exposed to somebody or not, you have to think about what actions you took to put yourself in this position of risk as well. And that goes for every single one of us. And it's, again, I don't think it's anybody's fault when they get COVID, as much as I might want to shake that person and say, we know what we need to be doing here. Nobody asks for this, nobody wants it. And as a matter of fact, most of the people I speak with are often shocked that they actually have it. So I think that it's been blown up into this huge, enormous monster that people don't see for what it is. But at the end of the day, it's a virus. Viruses are spread very easily, and they're also controlled relatively easily. I mean, if you can kill it with Lysol, it can't be that bad, right? So I think that we just need to get back to basics, and we need to get back to just kind of taking a deep breath and allowing ourselves to feel whatever we're feeling right now, and this frustration and this fatigue with it. But then really hunker down and decide that, what, we're there, like the vaccines are there. We're here. We're at the point where we're so close to being able to get past this thing that has consumed my life and the lives of so many people that I care about, and taken the lives of some people that I know as well. So I don't want to see deaths in this community. I think that I have been so proud to work in Kahnawake through this, because nobody has done it like this. And I keep telling everyone that at the end of this, they're going to have to do a study on the gold standard that was this community, because nobody is doing this the way that we are. And I think that, everybody needs to take pride in what they've accomplished. This is a huge accomplishment. And there are cases right now, and it's scary, but we have control. So I think we need to take back that control a little bit. And that's my plea to you. I'll keep doing what I'm doing in the hospital, and our public health team is there. We're here for you, and we are here to support you, but we need your help. So that's why Dawn and I came today, and I hope that everybody's safe. And my cases, I will be in touch. Thank you.
Juanita, appreciate the update. And that's it for our show this evening. It was a little bit of a longer show, but an extremely informative show with some good news and, of course, a little bit of bad news. We just want to remind everybody, stay out there and be safe. If you need to go out, don't forget to social distance. Please continue washing your hands. Remain in your bubble when you can. And this way we can all celebrate 2021 a little bit healthier, hopefully a little bit happier, and maybe with less restrictions in the months to come. From all of us here at Kahnawake 911, the MCK, the task force, Kmhc, and all the organizations involved in this program and doing all these restrictions and working together to help keep you and our community safe, we just want to wish you all a very happy New Year 2021. So, Nyawagoa, and Onigi Wahi. Nyawa.